Hey guys, Dr. Berg here. In this video, we're going to talk about what's really behind leaky gut. Okay, now you've probably been told that, well, gluten will cause it, and that's true. That's the protein in wheat. But what happens when you cut out the gluten and you still have the problem and it's not clearing up? Or people that really don't consume any gluten, what's the cause then? There's something else. It's basically a version of scurvy of your colon. That's a vitamin C deficiency. Now, I did some videos on this with the arteries, because when you have scurvy of the arteries or a vitamin C deficiency of the arteries, you can start having these little leaks that go into the blood vessel, and it creates an immune reaction, and it starts getting formation of cholesterol and calcium, and then you get this clot. Well, a similar thing happens in the colon. When you see, vitamin C controls the collagen formation. So when you're deficient in vitamin C, you'll get symptoms of like bleeding gums. That's because the capillaries are breaking down and you're getting bleeding. Okay. Well, guess what happens? You have this little lining, a layer of cells in your colon that allow food to be absorbed through like a root-like structure into the lymphatic system where you absorb the nutrients. Normally, those little gaps are between 1 and 7 microns, very, very, very small. When you have leaky gut, it becomes 200 to 300 microns. So you have these huge holes in your colon. And that's going to allow undigested proteins to go through the colon. Well, guess what happens? It doesn't get the stamp of approval from your immune system, immigration, and so your body starts attacking and building antibodies against those proteins. Thus the massive food allergies specifically to proteins and food sensitivities to other foods as well. But here you have all these food allergies simply because of this vitamin C deficiency. So you got food allergies, and then you have immune reaction, you have inflammation, scar tissue, and now you can't absorb food after that because it's just not working, and you have these malformed junctions. Okay, so here's a question, like, why are you deficient in vitamin C in the first place? Could it be your diet? Is it because you don't consume enough vegetables? You need a good amount of vegetables, at least 7 cups every single day to get your vitamin C. When you take a supplement, most vitamin C comes in a synthetic version of ascorbic acid. And some people take that and think they're getting the whole vitamin C complex. But in reality, vitamin C in nature comes in different parts. So if I were to show you right here, vitamin C has a very small protective outer shell. It's called ascorbic acid. But inside, you have the P factors, the bioflavonoids. Okay? Bioflavonoids. And then you have the J factors. That's the anti-pneumonia vitamin, increases oxygen, copper, and vitamin K. So you have a lot of complex things inside that vitamin C complex. That's how nature has designed vitamin C. The one that is really specifically aligns to this problem is the deficiency in the P factor, the bioflavonoids. So when you take ascorbic acid, you don't get any bioflavonoids, okay? So it really doesn't work. So here's some foods that are very, very important, that are very high in bioflavonoids to help heal that collagen. Sprouted buckwheats. Okay, you can get, I would get that as a supplement. Find a supplement that has sprouted buckwheats. There's one from Standard Process called Cyruta Plus. That's one. There's others on Amazon. I'll put some information down below. I don't have any brands that I'm recommending other than Standard Process is a good one. Quercetin is a bioflavonoid. Parsley, onions, green tea, citrus, lemons, limes, all these are very high in bioflavonoids. A lot of the vegetables, most of the vegetables, especially cruciferous, are loaded with bioflavonoids. But let's say you're consuming these foods, but you're still having this problem. It could be, it's not that your diet is deficient in vitamin C, it's that you have insulin resistance. You have too much insulin, you're pre-diabetic, or you have symptoms of a subclinical prediabetes, which is not really showing up, but you have all the symptoms. This is going to create a lot more insulin, and higher insulin will deplete your vitamin C. Boom, that's one thing. So you have to correct that if that's the problem. The other cause of vitamin C deficiencies is smoking. One cigarette, if you smoke one cigarette, you're going to deplete at least 25 grams of vitamin C. So here you're smoking and then you're depleting it. You're not knowing that's causing that. It can set you up for a vitamin C deficiency. Okay? So I just wanted to give you some solutions to this problem right here to actually help heal this. And these are some good things. And also you're going to have to stop smoking if you are a smoker. That's going to really help you as well. Thanks for watching. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now and we'll send you a report.